My name is Jonathan Riboh. I'm a sports medicine surgeon and clinician scientist here at Duke. I treat a wide variety of conditions, primarily the shoulder and knee. The most common procedures I do are ACL reconstructions in high school and college athletes. Probably second most common would be shoulder instability surgery for athletes who have had a shoulder dislocation. And third most common after that would probably be kneecap instability or patellar instability for patients who have had dislocations there as well. One of my very early patients at Duke and one of my favorites was an 8-year-old boy who aspires to be in the NFL, like a lot of 8-year-old boys do. And he was 8 going on about 16 if you looked at his size. And tore his ACL playing football when he was 8, which is much, much younger than we're used to seeing those injuries. And he's from Southern Virginia, and he saw a number of local orthopedists who told him there's nothing they could do. He was too young and he just couldn't play sports anymore. They eventually made their way to me, and we were able to offer him a growth-sparing operation to reconstruct his ACL, which not only gives him a stable knee, but has almost a 0 chance of disturbing his growth over time. And it was about 9 months from his operation before I finally gave him the green light to go back to sports. But if you could see the glitter in the kid's eye when I said go, it sort of made it all worth it. And I think he was just, nobody's more grateful than children, and that's the best part of what I do.